So of course you don't want to think about not being able to have immediate skin to skin with your baby. Of course, it's so important to prioritize having skin to skin. We know in research that a baby transitioning from the womb to the outside world, they are typically immediately placed on your chest for that skin to skin care. And it's really important because babies, they experience the world with their senses. So they use their sense of touch and smell. They recognize your voice instantly. And the areola has little glands on it that secrete an odor that smells like amniotic fluid, which is so cool. So babies literally like start to crawl down to the breast because they are familiar with this smell, which is just incredible. Um, the reality is that, we can't always have this golden hour of skin to skin. And Niels Bergman, the, founder of all of this amazing research about skin to skin and the benefits of skin to skin, he actually really talks about how it's the first 1,000 minutes too that we should be aiming for skin to skin, which is 16 hours in total. A long time, and realistically, a lot of people don't get to do that. But if that is something you want to prioritize, it is incredible because he says that this time, skin to skin after birth, is what can wire up a newborn's brain for resilience for life. So, this is about neural pathways wiring up together that are connected between our emotional center and our sensory system. So, essentially, when we feel really safe and calm, which is for a newborn on a parent's body or on a body, skin to skin, just in that lovely containment, close to the body, feeling so safe and secure. This is a really different environment to a baby screaming at birth on a resuscitator or needing some support with breathing. Of course, we can't control everything. And so this is about surrendering to variables, understanding what is best practice, but then giving ourselves compassion and kindness when things don't go as expected, because we can't have perfect situations in every outcome. So what you might want to do is prepare for someone that you really love, your partner, a grandparent, a really close friend who's with you, a co-parent, to be there in the instance that you're not feeling well and not up for skin to skin. Or maybe you guys make a plan for like shifts of skin to skin. So baby gets this time skin to skin while they are transitioning to the extrauterine world for as long as possible, essentially, because it will really benefit your baby to feel so safe and adapt to the world with that sensory safety while they are, adjusting. So, some of the situations that I have seen is maybe instances when babies might need a bit of help to get going when they're born. An example might be for a planned cesarean section. So, when a baby is born by cesarean section, there can be a common situation where a baby might have a bit of lung fluid because they haven't gone through, the hormonal cascade of birth, and labor hormones are not happening for a cold planned cesarean section. We call them a cold Caesar. So for this baby, they don't know that they're coming out at that time, and they might just have some retained fetal lung fluid. This is something that I have looked after lots of families with, and it is something that can come as quite a shock if you have planned to have a cesarean section and you haven't been exposed or been prepared that this could be something that your baby might need help with. Really, it's equivalent to like when you blow up a balloon. If you imagine like that is the lung and your baby is blowing up that very first breath, and that's really a lot of pressure that they have to generate, especially if there's fluid in their lungs. And so often what will happen is they will go over to a resuscitator or have some support from a pediatrician or a midwife or a neonatal nurse who will help your little baby to take that very first breath and hopefully clear that lung fluid. Sometimes that is just 10 minutes in the birth space, and then they transition well, they start breathing really well, and then you have your skin to skin contact. Other times they might need a bit of monitoring in the nursery or perhaps a bit of CPAP. This I know might feel worrying just the variable of this, but this is the reality of preparing for variables. Just like we prepare for birth and a vaginal birth, perhaps, there's always a possibility of an emergency cesarean section if something changes and your care escalates to a different pathway. So, this is simply another pathway that can happen. And I think the most important thing to know is that this time, if you don't get to have the skin to skin at birth, a lot of women and birthing parents really grieve this because of the language that exists in culture, just like the golden hour, everything is just fixated on this like kind of simple pathway. But it's not that simple, and it's something that we need to acknowledge we can't control. So having a plan for how to optimize skin to skin opportunities is great, but also just know that your baby is also going through an incredible time of neuroplasticity and growing neural pathways every second, wiring and firing those pathways. And we know in neuroscience and in research, someone I love is Dr. Greer Kirschenbaum. She's a doula and a neuroscientist. I love her approach. And she talks a lot about how we can repair these pathways with lots and lots of nurture and skin to skin as soon as that's possible. So, for families that maybe have a preterm baby, for example, if they engage with their baby's senses in a way where they're collaborating with the healthcare team and their baby may not be able to have that skin to skin, for example, then you would just plan, the moment that that can happen, you're going to have so much skin to skin. You can wear your baby all day in a carrier and really make up for that time and have compassion for yourself and for your baby and for your entry into motherhood because, like I said, we just can't control everything and we have to be so kind to ourselves because, of course, we're just doing the best that we can. And in my experience, I've looked after a lot of families who have never heard of this before, or maybe they've planned to have a cesarean section and they didn't even know that this could be a possibility. And whilst it's not common, I do think it is an important thing to know exists because it is just one of the variables. And it's important to know what we can do, which is nurture the shit out of our babies and be there for them and, just know that that is the best we can do. And we just have to do good enough because there is no such thing as perfect in this season of life.